in our structure, we've got, now, I have had nursing faculty tell me that they have students who do not know atria versus ventricles. Please don't leave my class and not know this, okay? Because it's atria to the top, ventricles to the lower, AV. It's in alphabetical order. And we got two of each. Two atria, two ventricles. Our atria are our receiving chambers. My right atria receives it from the body and the heart circulation also. My left atria receives it from the lungs. So those are my receiving chambers. They have this flap called an auricle. On your models, you should probably see these little flaps, okay? These little flaps are called auricles. What they do is they tend to give more room. So in times when blood volume increases, and it does, okay, these auricles allow for that increase. Ventricles pretty much set, okay? You begin stretching those ventricles out and don't let them go back into shape, things are going to go bad quickly. They are separated because you have right versus left, and even though our models are not great for the atria, okay, in between left and right, we have an inter, meaning to the inside, atrial, between the atria, septum, wall. They have pectinate muscles. Do y'all have a little flap that opens? Or, okay, it looks like it's on this part right here, showing the atrium at the top. See how they're trying to show these ridges? Okay, pectinate muscles. All right, our ventricles pump and, well, it's the pump that ejects blood from the heart. When the heart beats, okay, and this bottom portion does its twist, the blood that's in the ventricles gets squeezed, pushed out. When it pushes out from the right side and goes through my pulmonary trunk, okay, it's going to the lungs. When it leaves the left side and leaves by way of the aorta, it's going to the systems of the body. So this is where the blood actually gets, well, let's go with ejected out of the heart. To me, it's pushed, but that's just me, okay? So, on the surface of our heart, one of the things you'll notice, like if you look at this outer portion and around the sides, for these areas where the blood vessels are found, this yellowish-like color that they're showing, we're going to find that these are going to have the fat be present. Now, oh, for the ventricles, Once again, we have a separation, a wall. You can see that very well in your models, okay? And then there are ridges on the inside, like if you look at the inside of the ventricles, okay? The ridges that are here are my trabeculae carneae. Yes, they got very inventive in lab that day. But for the surface, when you look at the surface of the heart, these vessels that are on the surface of the heart, the protection that they have as they sit in their sulci, the protection they have is the fat. Now, the last thing you want to be told is that you have any viscera that are fatty. Okay? This is what they're referring to. They're referring to the fat buildup, covering and protecting that viscera. And in the case of like a fatty liver, have you ever known someone who's been told they have a fatty liver? Okay, that's very bad. All right. Usually, if the person goes on a diet, they can decrease it. Okay. The goal is to decrease it to keep the liver functioning correctly. But a lot of times, it's going to begin to interfere with that liver's job. And the last thing you want is for that liver not to work. Okay, that's really bad. So we have our coronary sulcus, which I kind of pointed out in the last picture. And then we have our other sulci that are present. You can kind of see them being represented. So the sulci are the grooves that are holding these vessels. Our models don't perfectly show our atria, okay? Atria are smaller. As the blood returns to the heart, for the most part, for the atria, blood just trickles in, all right? It's not like it's this huge rush, and if you were to look at it in motion, it is a bit of a rush, but compared to ventricles, it's not, okay? So blood doesn't enter as quickly to the atria as it does the ventricles. Plus, where do you see the actual cardiac muscle? Is it around ventricles or atria? Ventricles. So that tells me atria, their muscular capacity is almost nil. But ventricles, a lot. Especially the left side. Because the left side needs to make sure that the blood ejects and with enough pressure to move to all these tissues of the body. From the upper portion, where the aorta and the branching occurs, this blood has to move against gravity. Once it goes over the arch, gravity gets to help. Veins, which are returning it to the heart, for the most part, the majority have to work against gravity. Very little of it gets to flow with gravity. How do I keep that blood nice and circulating based on that? Because my veins, pressure is almost at zero. So how is it that the blood in my veins gets to go back to my heart? How is it that the blood at the tip of my big toe gets to come back to my heart?
Is it due to like vasoconstriction and dilation of the vessel itself?
Not with the veins. Alex?
Skeletal muscle contraction.
We are dependent on movement. We are dependent on actually moving our skeletal muscles so that the skeletal muscles can create a squeeze on these veins and push that blood against gravity. People who are very sedentary are not going to have very good blood circulation. So, the valves that are going to be present between my atria and my ventricles, and then to my greater vessels. Okay, when we look at the left and the right side of the heart, what we find, because their names, okay, their names are going to be able to help you remember where they're located. I'm going to see that I have valves that are present, which we pointed out. Their job, let the blood go one way. We do not want any backflow of blood whatsoever, no matter where we're talking about in the body, okay? It can't. Well, when you have a murmur due to one of the atrioventricular valves, note I'm trying to point that out, okay? You're going to find, well, actually, any of the valves that don't function right, they're going to allow blood flow to come back, and that's not good. So, depending on where it is, how bad it is, will determine, do you have to have surgery. Some people have to go in and have a valve replacement. Ever heard of that? Okay. So the valves ensure the one-way flow. We're going to find a valve between an atria-ventricle. We find our valves going into great vessels. Okay? So, when we look at their structure, they're going to have the flaps. Flaps are going to be referred to as cusps, usually. Very seldom hear them referred to as leaflets, but that can be a way that they're referred to. But when you look at them, they refer to them as being cusps, okay? So, since I have two sides of my heart, all right, have my right side, my left side, so therefore I have a right atrioventricular, and that's being represented in this model right here with this one with all these cords attached to it. And over here, they've kind of, you know, pushed it back a little bit, but this is the left atrioventricular. So you will hear them referred to as the right AV, left AV, or tricuspid mitral. Because when you look at this right side, looks like there's 3 cusps that are present. On the left, it looks like it's 2, okay? So you may hear it called the bicuspid. One that you'll hear a lot of people getting replaced on this one. The bicuspid valve was replaced. We're finding with my atrioventricular valves these cords that I keep mentioning. These are chordae tendineae, tendinous cords. Think about tendons and other areas of the body. These are tendinous cords. And note, they are attached to something that looks like a mountain. And what that is a papillary muscle. So why is this structure present? Alex?
It's prevent backflow of the blood.
We got to prevent backflow. Now, couple of things.